It is truly a pleasure to me to introduce our guest speaker for the evening. So he also is chock full of patience, sitting here being entertained watching us before things get going and hasn't laughed too loudly, so I appreciate that. Our guest this evening is Dr. Jonathon Dalton, and he's going to be speaking with us about anxiety. Dr. Dalton is a licensed psychologist, public speaker, and author who founded the, my screen just jumped, Center for Anxiety and Behavioral Change, CABC, which is based out of Rockville, Maryland. It's a private treatment center dedicated to using evidence-based treatment for patients with anxiety disorders. He received his undergraduate degree in psychology from Villanova University, a master's degree in psychology from the Catholic University of America, and a doctorate in clinical psychology from Fordham University with a specialization in child and family psychology. He completed 2 years of pre-doctoral training at Johns Hopkins School of Medicine, Kennedy Krieger Institute, and advanced postdoc training at the Maryland Center for Anxiety Disorders at the University of Maryland. He specializes in the treatment of anxiety disorders in children and adolescents with a particular focus on anxiety-based school refusal. He frequently consults with school systems across the country, provides training to other mental health professionals, and presents to community organizations. So I'm going to be turning things over with a big thank you to Dr. Dalton. If you have questions for him as he's going along, please go ahead and put them in the chat. Those of us behind the scenes will be copying them over and helping to run through them at the end of his presentation. So without any further babbling from me, here's Dr. Dalton. Thank you.
Great. Thank you, Michelle, so much for all of that and for all of the work that so many of you do. I have deep regard for the work that SEPTA is doing, and I appreciate you talking about the teachers as well, because I'm talking to many schools across the country these days, and this is what I'm hearing is that this year in many ways is harder than last year, and it's hard for the students and it's hard for the teachers, and everyone is struggling to some extent. So I just wanted to acknowledge that and the work that you guys are doing, and of course the wonderful work that all of the educators are doing. Okay, so I have many slides, and I love my talks to be somewhat conversational. So please don't hesitate to type some questions into the chat. I can see when a chat question comes in, I just can't actually see the question. So someone will read me the questions, and try and not make them too specific for your particular child, but certainly ask questions. I don't pretend to have a monopoly of knowledge or information on how to help kids with anxiety. But I will be talking today about how we are shifting what we've been doing historically during the pandemic, because I think it's important for us to really stress and underline resiliency and related factors. So we'll be talking about those things, but I will also be sharing some really scary numbers for all the parents on this call to really understand just how much the kids are struggling right now. It's important that we go through and look at the data on the level of anxiety and related disorders that was there 2 years ago before COVID hit, and then the numbers that are emerging from the research community about the impact of this on the kids and teens, and some of this data will take your breath away. And I don't intend that to be the point. The point is to give you a toolbox of specific things you can do about it, but it's really important that everyone understands the situation that we're finding ourselves in, because it's a really difficult place. You know, a lot of us kind of marked the beginning of the pandemic remember when Tom Hanks was diagnosed on TV, and then the NBA shut down that day, and that was March 11th, 2020. I looked it up before today's talk. That day was 615 days ago. And that seems like a lifetime for us, but imagine for the kids and the younger students that are immersed in this, for them, their experience of it is much of a longer duration of time than it is for us. So I just wanted to kind of frame the discussion about how long we've been in this situation. Let me begin by saying I love my job. As Michelle was saying, I specialize in working with kids and teens who have anxiety that interferes with their lives, especially kids who are having a hard time getting into school because of their level of anxiety. And I really love the work for many different reasons, but one of the reasons is this, that I'm a firm believer that if you have a kid, and by kids I mean teens too, who is smart and creative and compassionate, the universe will go ahead and throw anxiety in for free. It really is this package deal. So rather than talking about anxiety as a flaw or a weakness, I want to frame it, what I think in a very accurate way, as a shadow cast by these virtues. And so the great news is that anxiety is treatable in the vast majority of cases. And when we give the kids kind of the owner's manual for the nervous system, when we help them to understand in a more informed way what they're going through, these virtues remain fully intact. And I believe that people that have to deal with anxiety when they're younger and then get treated for it effectively, they're learning things they wouldn't have learned probably any other way, especially at that age. They'll learn how to overrule fear as a decision-making tool. They will learn how to pursue their values rather than to pursue their comfort. And these are lifelong skills that can be of tremendous utility for the duration of their time here. So I just want to talk, when we're talking about anxiety, to point out that these kids won the lottery in many ways. They are extra alive. And if you happened to catch 60 Minutes last week, it was really interesting. They had a neuroscientist on, and they were talking about the reality that the same brain structures that are responsible for anxiety and fear play a huge role in empathy. And so we're seeing the underlying neuroscience really solidifying what we know clinically to be true, that this is a package deal that we see. So that's one of the reasons I love what I do. I work with great kids from great families who are extra alive, who care deeply about the world and themselves, and that makes them vulnerable for anxiety. The other reason is I learn a tremendous amount from them. And so the next one is actually a quote that one of my former patients wrote on their common application essay to college. And this was an individual who missed between 2 and 3 years of high school, literally, because of an anxiety disorder, and just graduated from a top university this past year. And they said, this is the first line, that having an anxiety disorder is like being stuck in that moment when you've realized you've leaned too far back in your chair, but have not yet fallen. And to me, that really captures the experience of being in that state of chronic anxious arousal, of having that jolt, but being stuck in that moment. And we're talking not just about kids and teens, we're talking about students. And we'll be mentioning throughout today's presentation the effect of anxiety on the learning process, because it has a profound effect on students' availability to learn, process, and retain new information. So we'll be talking about that. But I want to go into now why I think anxiety is so often misunderstood. One of my pet peeves is when people will call up and say, oh, the problem is my child has anxiety. My reaction to that is, well, thank goodness, because evolution wants us to experience anxiety. It's an alarm system that is really primal and vitally important for our survival. It's our spider sense tingling. It tells us there's potential danger ahead. So it stops us from doing dangerous things. In the same way that pain stops us from doing things that are going to damage our body, anxiety plays the same role. In another way that it does that is that evolution wants us to avoid things that make us sick, make us hurt, or make us scared. And so if we've been in a situation where something happened and we either got really sick or really scared or really hurt, we're not likely to forget that memory ever in our lifetime, nor are we likely to repeat that mistake that caused that situation to occur. So if it makes us scared enough, hurt enough, or sick enough, we only need one time to pair that experience of anxiety and with that situation to learn to avoid that situation again. If you've ever had food poisoning after eating something you used to enjoy eating, you'll understand the power of that conditioning experience, because you'll never want to look at that thing ever again. And the same thing is true with fear. Now, an anxiety issue becomes a disorder, not based on the intensity of the anxiety. That's a common misconception. We can and should be really anxious in certain situations where there's actual danger present. That's not disordered. What an anxiety disorder really is it's a false alarm. It's a false alarm because the fear, the anxiety is 100% real. It's the danger that's missing. But we can't tell that. You know, if you are cooking your breakfast and you put your bagel in the toaster and you go upstairs to finish getting dressed in the morning and the smoke alarm in your kitchen goes off, you can never tell by the sound of the alarm whether you burnt your bagels or the curtains are on fire, because the alarm's going to sound the same. And that's true of our anxiety alarm system as well, that when it goes off, it's either on or it's off. It's binary. And so because of that, that instinctual, safety urge to avoid or escape still manifests. But the challenge with that, and I wish I could circle that bottom right where it says leads to unnecessary avoidance, because that is the central concept to the evidence-based care that we and other places that are around the country that do what we do, it's what we provide, is that unnecessary avoidance. Let me talk about that for a minute. If we avoid something that is scary but not dangerous, we are firing the best teacher that we'll ever have, which is our own experience that would have informed us that while the fear was real, the danger never was. And so because of that, then the anxiety will persist. And so I want you, everyone listening to this, to think of unnecessary avoidance. We call this avoidant coping, is our term for it, is the lifeblood. It is the foundation of all anxiety disorders. I always joke that I have this challenge that I run an anxiety treatment center, but we don't treat anxiety because we don't have to. Anxiety is two things. Anxiety is temporary and anxiety is harmless. What we treat is avoidance, and it can ruin lives. So I'm sure that some of you are logging on for school refusal related issues or kids that are having a hard time getting to school. And that's simply the furthest example of the use of avoidant coping. Now, the great news is that if we decrease the avoidance, if that's what our goal is to give them better, more appropriate, more effective skills to manage their emotional system that do not include avoidance, well, then the anxiety will die a natural death. It's like turning off the oxygen supply to a fire, that the consequence will be the extinguishing of the flame, even though we never touch the fire. And that's what we are doing in this situation. Okay, so as we're going through this, this is how we treat disordered anxiety, where it's markedly impairing daily life. People are avoiding school, they're avoiding many different things, talking in public, whatever it might be, asking somebody on a date or giving a class presentation, and there's an infinite number of things people avoid. But now we're in a world where there's frankly more danger than there used to be. I'm working with a student whose parent had an organ transplant and are on very strong immunosuppressant medications, and that parent's had multiple rounds of the vaccinations, but they're still at high risk. And so when this student is worried about coming home and giving COVID to their parent, that's not a disordered fear. I mean, there's a reality to that. It's still impairing. So we'll be talking a lot today also about how do we help the kids during this difficult time when there actually is more danger present. But I wanted to preface that by talking about anxiety disorders and the central role that avoidance plays in that. Okay, are there any questions so far about anything I've mentioned? I can't see the chat room if there are questions in the chat room. Maybe Michelle, you could just kind of stop me at any point. I'm very flexible with these things. I can go in 1,000 different directions. I just want to make sure this is working for everybody. Okay. Let me talk about some things about anxiety that are really important to understand. And so let me just talk about the top 3 things that I want you to know about this category of mental health disorders that we call anxiety disorders. And it's not singular, it's plural. There's many different flavors, so to speak, of anxiety disorders. There's 3 things that make it really, really important to understand. It is the most common. So even among adults, before COVID hit, 40 million American adults in any given day meet criteria for at least one anxiety disorder. It has the earliest age of onset, so half of all individuals who will have an anxiety disorder during their lifetime will have it prior to their 11th birthday. And thankfully, it's the most treatable category of mental health disorders. We have highly effective and yet tragically underutilized interventions for youth living with anxiety. These are all pre-COVID numbers, by the way, and so just hold on until we get to the numbers that are just breathtaking for where we are now. Between the ages of 13 and 18 in any given day, pre-COVID, 8% are going to have an anxiety disorder. But if we look at those years, how many kids are having at least one disorder of an anxiety disorder between the ages of 13 and 18? It's nearly a third, and the numbers are worse for the girls, like a lot of things in life, than they are for the boys. 8% will have a severe anxiety disorder. These are the kids I really enjoy working with who really are showing significant impairment. And that bottom number, it varies from the number I put down to some are as high as a third. But a minority of these kids get any treatment whatsoever for their anxiety disorder. And if we compare that with ADHD, ADHD has a 79% utilization of treatment rate. And so unfortunately, only a minority of those who receive treatment receive evidence-based care that works. And so a lot of those kids see someone who's not expert, doesn't use evidence-based treatment. The kids don't get better, but the kids don't know that they were never given a treatment that works for what they're dealing with. So what do the kids think? Well, naturally, they think it's they who don't work. And they start to feel helpless and even hopeless about their ability to get better, when the reality is they were never given an effective treatment that we know to work for the vast majority of these kids. Okay, I mentioned the girls. Again, pre-COVID, 38%, so nearly 4 out of every 10 girls before the age of 18 will have at least one anxiety disorder, and those that have one tend to have more than one. Now, let's take eating disorders, for instance. They are real and serious and can be life-threatening, and they deserve every bit of attention they get, with adolescent girls in particular, although it's rising in boys. But anxiety disorders are literally 10 times more common. We have 38% versus 3.8% of these young individuals will have an anxiety disorder. So it's important that we all understand the water these kids were swimming in before this hurricane of COVID struck everybody. As a comparison point, before COVID, the average teen was between 5 and 8 times more likely to show symptoms consistent with an anxiety disorder than the same age kids were during World War II and the Great Depression. Okay, so we were calling this the age of anxiety 2 years ago. Between 05 and 14, depression rates increased by 37% in those 9 years, which of course coincides with smartphone technology. And it's not just the high school students. If we extend it out further, we see really scary data about how college students are functioning, how frequently they felt overwhelmed. And again, this is before COVID hit. Look at these 10 years that lead into the pandemic. Look at these increases just for a second, and let's translate that into the human experience of being a teenager. And so look at that, from 26% to 37%, so more than a third are reporting persistent sadness and hopelessness. Almost 1 out of 5, 19%, in 2019 were seriously considering suicide. 16% were making a suicide plan, and 9%, almost 1 in 10, are attempting suicide. It's really important that we understand that different identities are experienced in the world in different ways. And so we know that when it comes to these numbers, that LGBTQIA+ individuals are a higher risk for all of these things. And women in general are as well. And there's some really great data out there that shows, I know this is a hot button issue in Loudoun County in particular right now, but using preferred pronouns and using preferred names can decrease depression and suicide attempts among that population by between 60 and 70%. Okay, it saves lives. And the data is coming out very, very strongly about those things. So anyway, this is the numbers of suffering, of depression, of anxiety that we were seeing, and then COVID comes in. So hold on to your hats, because wait until you see these numbers here. This was published, they were looking at the mental health care claims for reimbursement nationwide. So this is pretty accurate data. And during a 12-month time period for teenagers, they found, now I'm going to read these because these are worth taking the time to process these. There was a 334% increase in intentional self-injury in a 12-month time period. Overdoses more than doubled in a single year. Generalized anxiety disorder, which is a worry-based disorder, went up by about 94% over 12 months. Adjustment disorders that are basically a reaction to a stressor that can include depression, anxiety, and or conduct disturbances went up by just shy of 90%. And there was an 83% increase in major depressive disorder. We were talking about this 37% increase in over 9 years as being breathtaking. Well, look at these in 12 months. And what I'm hearing when I present this data to school staff across the country, what I hear is that people are heartbroken and yet not surprised, because people are seeing this in their day-to-day life. And I know that we're seeing it. And I know other mental health professionals are seeing it. And I know that probably a lot of you are looking for mental health services. And I'll tell you, the mental health infrastructure in this country is stretched beyond all limits right now. It was not designed for this level of need. And the country is failing these kids because there aren't enough services for the level of suffering that are going on right now. So those numbers that I was talking about, those 12-month increases, look at what that looked like in comparison to medical claims in general. So not only were these increasing by that much, but look how much they were divergent from the overall medical claims that were going on. It just speaks to how much different the mental health world was responding compared to the physical health world, especially in the early months of the pandemic. I wish I could say that the news is getting a lot better, but it's not. So in August, there was this meta-analysis, which simply means it was a study of studies. They looked at all of the studies that were published about mental health care in the world that met their criteria for being a high quality study. And they just defined it as youth. So I'm not exactly sure what the age ranges are. I think it varied. But what they found is that globally, 1 in every 4 youth are experiencing clinically elevated relevant depression symptoms. 1 in 5 are doing that for anxiety. But the last one is the part I want you to pay attention to, which is that across the world, they're finding that in these different locations, that the rates of depression and anxiety have doubled from where they were before the pandemic hit. And they looked at which studies were showing more struggling and more suffering. What they found was the reverse of what we would hope for, which is that the further along in the pandemic the data was collected, the worse the kids were doing. So rather than this being something that was a jolt that the kids kind of adjusted to, think of it more like a weight that got heavier and heavier the longer you held on to it. And so we were looking at those terrible numbers of where we were in 2019. And now we can double those, literally, to see the level of suffering and despair that I know I'm coming in contact with every day with the kids and teens that I'm working with. Okay. Now, thankfully, the younger kids are somewhat more protected. Now, frankly, there also isn't as much research about these kids. So they mostly look at parent report. And so this study found that about 1/5 of parents are reporting that their children's mental and emotional health are suffering, which is horrible. I mean, that 22% increase in the calendar year is awful. But compared to where we were with the doubling in the teens, thankfully, the younger kids are living in somewhat of a bubble when they're still relying on family of origin for their primary source of social support. They are able to do more activities. Now, frankly, a lot of those kids were struggling during distance, asynchronous and hybrid, and all of these new vocabulary words that we didn't have to worry about before. Let me pause for a minute. Were there any questions in the chat? Let me see if I can pull it up here.
Dr. Dalton, this is Amanda Campbell.
Yep.
I do have one question that we've gotten from the chat so far. Do you see an increased number of children with special needs that have an earlier onset of anxiety?
Yes, but in very specific circumstances. So what I'm seeing are the kids who have ADHD, ASD, or similar acronyms, learning differences of some variety. The gap has widened during the time of distance learning. And what I'm seeing is that 2 things happening. Number one is those kids are just falling terribly behind. And I think that the country is becoming aware that there is a divergence in that. And then these kids are getting overwhelmed and they are getting very, very anxious, or they're just tuning out the world. And what's happening is they're watching themselves not succeed. And they are starting to really harbor a negative self-view, that they're not competent, they're not successful. And I'll be talking in a few minutes about how I'm approaching that for those kids. But the IEP 504 kids, in my opinion, are at a much higher risk for these levels of distress related to school attendance in particular. And of course, kids with ADHD and other kinds of concerns, they're more at risk to begin with. And I'll be showing a slide in a few minutes about that. So I don't know that there's data being collected on that. Anecdotally, in my work, with our team's work, there's 10 of us, and with my colleagues outside of my practice work, absolutely, those kids are at a much higher risk. Yeah, great question.
Thank you so much. I think that's the only one that I've seen come in so far.
Right. Okay. Okay. I was giving a talk in Cincinnati a couple of weeks ago, and I had to update my slides in the hotel room the night before, because October 19th, so just not even a couple of weeks ago, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association all together declared, it made the news, a national state of emergency in children's mental health. And they had a list of requests from government for increased funding and support and increased training, all of those kinds of things. And I'll tell you, I give a lot of talks to schools, that 75% of all mental health care to children and teens in this country is delivered in a school setting. And so I know we have a waiting list, and everybody I know who does anxiety work right now has a waiting list. And so what's happening is that it's falling onto the schools, which were already overburdened with terrible needs, of kids who were struggling. And so now that's what I'm seeing time and time again, is that it's all flowing downhill to the school counseling staff, school psychologists, school social workers, and frankly, the teachers as well. So they are kind of the integral link in this chain, so to speak, of the interventions for kids, because there just isn't enough accessible in different places. Okay. I mentioned, and this is pre-COVID, because I don't know there's data out yet about the effect of COVID, but even before COVID, if we look at kids who have a specific learning disability, on any given day, almost a third of those have an anxiety disorder. ADHD has the highest co-occurrence with anxiety disorders. Some estimates are as high as 60% lifetime prevalence rates of having an anxiety disorder. And that makes sense because ADHD, processing speed challenges, these are not just situations that affect your education. They affect your interactions. They affect the way that you see yourself and your impulsivity. As a total aside, I can't tell you how often, and I don't know that, again, there's data to see this, but as someone who specializes in working with school refusal, I see this all the time, where there are kids who, once they reach middle school, start to exhibit social anxiety, depressive symptoms, and then stop going to school on a consistent basis. And many of those kids have a processing speed disorder. And so if you have a kid that you love who is exhibiting some of those symptoms, just make sure that we have current data on their processing speed, especially auditory processing, because I see that really affect kids' ability to have conversations in middle school and early high school, and it leads to a lot of anxiety that looks like social anxiety, but it's really directly downstream of not being able to process the communication effectively in real time with their peers, which makes them anxious in the same way that someone with vertigo and crashes their car a lot is going to be anxious to drive. It's not a disordered fear, but it certainly is impairing in that way. Okay.
If you have a second, Dr. Dalton, we do have another question that came in.
Yep, go for it.
Somebody indicated they'd be interested to know if there are measured differences among children between school districts or schools that remained open and those that were closed or virtual.
That is a wonderful question. I was working with a school that, a local school that works with kids with hearing impairments, and so they were open all of last year. Because being on Zoom is so much more challenging to read lips or to, they don't even use sign language there. But so they were open all of last year with very, very strict protocols in place. And what I was hearing, and those are younger kids too, but I was hearing from that teacher population just a few days ago that those kids did remarkably well. So I would assume that the more that kids were in the school environment, the better they're going to be. We'll be going through resilience in a little bit, but connectedness is so critical for mental health care and for mental health in general. And so the more kids could connect with each other, the research would suggest very strongly that that was a protective factor against the development of emotional disorders, especially anxiety disorders. Good question. Okay, briefly, let's talk about the way that anxiety also affects learning. So those of you who don't know, I'll explain different memory systems in just like, a 1-minute synopsis. If I ask you for your phone number and you tell it to me by memory, that's your long-term memory. If I tell you mine and ask for it back in a few moments, that's short-term memory. If I ask you for your phone number backwards, that's working memory, being able to hold, rotate, manipulate information. And it is central to learning and being able to display your knowledge. So whether it is reading comprehension, math, the data is very clear that working memory is really, really important to being an effective student. And we also know that working memory is the most vulnerable cognitive system to anxiety. So if someone's in a state of anxious arousal, their working memory will be degraded and they will have a hard time retaining information or displaying and communicating what they do know. And many of these kids, they don't know the information. So they're nodding along and it seems like it's making sense because they're hearing it from their teacher. And in that moment, they're able to kind of write it down or think about it, but they're not encoding it. They're not able to use it and analyze it. And so then when they're asked to demonstrate that knowledge, they're almost shocked to learn that they can't because they were there that class period, but they never really were able to use the information. Okay. Another reason why it affects the learning process is that think of it like RAM on your computer, that the more programs you have open, the slower the entire CPU runs. And that's true of our brain too. And so when we have a lot of intrusive thoughts about that kid just sneezed next to me and coughed and his nose was showing, does that mean I have COVID? Or I wonder if mom's okay because they have separation anxiety and are worried about mom being in a car accident. Or they're gonna think I'm weird because I flubbed that class presentation, or whatever the intrusive thought is, it's going to compete for limited resources. And threat cues are always prioritized in our thought process. So like we want to avoid snakes that rattle. As a general rule of thumb, that's a really good idea. And if we were all in one room and I said, hey, don't worry about it, but I did see a rattlesnake before in here, but it probably went away, I wouldn't worry about it. I promise you wouldn't hear much of what I was saying because evolution wants you to prioritize threat cues. Now, the one thing about anxiety disorders, there's all kinds of different categories, but they have one really important common thread. It's a complicated term, but an easy concept. And that term is called overvalued ideation. Don't worry about that. All it means is we think our thoughts are more important than they are. We confuse thoughts with evidence. So because of that, this is true of all of us, but more true for kids, that they will perceive their own thoughts as threatening. And so those thoughts get red flagged and they are prioritized in our thought process. And the teacher becomes, the Charlie Brown wah, wah, wah noise in the background as they are thinking through the thoughts that they themselves are perceiving to be threatening. And the last one is really important to understand. When I talk to my kids and teens and I say, what do you wish that people don't know about you that you wish they did? And the most common answer I get by far is how exhausting it is to be me. That it's like having a second full-time job. And I call it the shake and soda can syndrome, that these kids are working to contain their emotional control system at school all day. Whether it's frustration tolerance because they're not being taught in a way that they can learn, whether it is attentional focus that takes so much to focus, or whether it's just trying to regulate their arousal system from anxiety, that when they come home, they explode like that shaken soda can. That so much pressure is contained all day. And then they come home and something happens and you pop that top and they explode everywhere and they store it up for the parents. And isn't that nice of them? But then also to have those kids turn around and try and do homework after they've been exhausted all day and now they get home is a really big ask for a lot of these kids to then be able to be productive in homework completion after that day. And these are really important ways to understand how this affects the learning process. Okay. Okay, were there any other questions that popped up in there?
Yes, we do
Okay.
have a couple. We do have two right now. The first one is, now that schools have opened, do you see kids develop more of a high-risk anxiety because they are scared to get infected with COVID, or those who have lost a loved one due to COVID complications?
So I have tragically seen kids who have lost loved ones and saw them buried and memorialized on Zoom and those things that too many of us have had to experience. What I am seeing is that most of my kids are not that anxious about COVID. What they are anxious about is social situations, because, I'm talking to schools. I was just giving a talk to a student body a week and a half ago or so, and I'm hearing the same thing from these different schools, which are the kids are about a year and a half behind emotionally, socially, in their study skills. And so these kids are feeling overwhelmed because they don't quite know how to learn effectively. They've lost some of their edge socially. They've gotten a little bit behind in their even athletic growth because of the pandemic. So I'm seeing a lot of that kind of anxiety. I'm seeing an increase in agoraphobia, which are kids who are afraid of being in crowded public places because that was a dangerous place to be for a long time. And so kids got kind of too comfy in what I call living in their cocoon. And cocoons are meant to help you grow, but these don't. They constrain you and they arrest your development in some ways. And so I've seen a lot of that. And what I've seen also, and this is why I'm giving so many talks about school refusal this year, is that we've tried for years and years and years to keep any kid who has anxiety-based school avoidance off of online education, because once they get a taste of it, it normalizes non-attendance, it's more comfortable, it decreases their anxiety, at least their experience of anxiety, but still leaves them really vulnerable for a whole host of long-term mental health challenges. And every kid in the country has had a huge dose of online school. So I'm seeing a lot of kids who are saying, well, that worked for me last year. Like, maybe I didn't learn that much, but I was comfortable and I wasn't scared about, people thinking I'm weird or about being apart from my mom or whatever the anxiety might be. And so I'm seeing a lot more motivation to not be in-person school this year, if that makes sense. Okay.
Yes, thank you. And that is it for right now.
Perfect. Okay, thank you so much. All right, here's the really good news, is that treatment really works. The main reason why I love my job, I get to see people get better in a 45-minute window often. They can do something at the end they couldn't do in the beginning. And so I'll tell you right now, if you are looking for services for your kid, never ever ask a provider if they treat anxiety, because everybody and their sister will say yes. Ask them if they use exposure therapy, because exposure therapy is the gold standard. You go to any evidence-based, university affiliated, research-informed provider, and they will be using exposure-based therapy. It is highly effective. It's about going on offense against the fear. It's about developing a non-avoidant coping style to deal with their level of anxious arousal. It's about developing a different relationship with the anxiety itself, and it's very effective. So much so that the research varies, but upwards of 70% of kids who get this treatment either show marked improvement or no longer have the diagnosis at discharge. And if you add in a med like Lexapro or Zoloft or one of those category of meds, then you're seeing an increase to 4 out of 5 kids are showing dramatic improvement. And these are in relatively short periods of time. This is not like, frequently a years-long process. And so that's the really good news, is that even during the age of COVID, even though there is so much suffering out there, these treatments still work. They're just not used as much as they need to be for the level of distress that we're seeing in the community right now. Okay. Okay. And I can see the chat now. I figure out a way to do that. And I'm so sorry to hear of your loss, Fanny. I've heard that from so many people this past year. The level of suffering in this world is beyond any measure right now. Okay, let me move on for a little bit here. All right, so let's talk about what do we do? What do we do now? And how do we help the kids with what I'm calling non-disordered but still impairing levels of anxiety, which means that their anxiety kind of makes sense, but it's still really getting in the way of their life. Okay. In other words, how do we create this life raft? How do we get the kids through the storm? And it's a really important thing. So here is, in a nutshell, an outline. I'll be going through these in more detail, really focusing on a few of these in particular. But I want the kids to learn. I want them to get that owner's manual for their nervous system. I want them to be an informed observer of what they're experiencing, what it means, and more importantly, what it doesn't mean in many circumstances. So education is so important, just so people can understand what to expect. I had to have back surgery 2 weeks ago today, actually. Never had surgery before, and it was really helpful to have the team there in the hospital tell me, okay, first you're going to feel this, then you're going to feel this, and then this is what's going to happen next. It helped me to kind of say, oh, yep, I remember they told me that was going to happen, and now this is happening. It really gives us agency over our experience when we can kind of narrate for ourselves what's happening and put it in the appropriate context. But resiliency is so central right now, and not just for kids. And so we're going to be spending a lot of time talking about the resilience building process. And thankfully, we can rely on a couple of decades of really solid research about how to build resiliency among kids and teens. And what's really important to understand is that resiliency is not a characteristic. It is not an attribute. It is a skill. And like all skills, it can be taught, it can be learned, it can be practiced, and it can be improved. And so we're going to go through what the research suggests are 10 powerful steps that we can help facilitate with kids to help them to become resilient. One of those being optimism. Optimism is also a skill. And so we're talking about that. And then tolerating uncertainty. Because it's the only option we have. I think of certainty as like trying to grab a handful of smoke. You can see it, but as soon as you try and grab it, it's gone. And if you think about COVID for a minute, talk about something tailor-made for anxiety. You have a killer who is invisible and can be in the room with you at any time and you won't know it. Heck, even a baby can give you something that can kill you. Or you could have something and give it to someone you love more than anything in the world and have them get really sick or die from it. And we don't know. I mean, we thought we were doing great in June, and then Delta decided to show up. And then, talk about uncertainty, lack of predictability. We've never had more difficulty trying to predict the future than what we've had recently. So instead of trying to have an illusion of certainty, we focus on increasing our tolerance for uncertainty, and thankfully, it's highly effective. The second to last here, I'm also going to spend some time talking about a fancy term called self-efficacy, and I'll explain what that means. I'll explain how I explain it to kids, and about what you as parents can do to cultivate this among your kids, because this is going to be what gets them through this, and what actually they can then take with them as a transportable skill as they grow through life. And then the other ones here, creativity and flexibility. My goodness, these are really important skills to have now more than ever before. And again, we can teach them. We can cultivate this skill set in the same way we can teach someone to play the flute or how to pitch a baseball. These are things that we can teach. And my dream is to have these skills delivered in a curriculum so that the kids can develop these coping skills in the same way they develop their knowledge of a Pythagorean theorem, so that they know these skills before they know they need them. In the same way, those of you of a certain age, with the original Karate Kid, where he was learning paint the fence and wax the car, and he was learning skills that he never knew he would need until suddenly he has to, and suddenly he's like, wait, I know how to do this. That's the dream here, is to cut off this pipeline of this development of anxiety that we're seeing exploding in adolescence right now at numbers we've never seen before. And so that's the goal, is rather than trying to fix the cars coming off the assembly line broken, it's how do we fix the assembly line so the cars don't need the mechanics when they first come off the line? That is the dream that I think a lot of us in the field are holding on to these days. Okay, so talk about psychoeducation for just a couple minutes. I could talk about this itself for hours, so I'll do it briefly. I want kids to understand what anxiety is and what stress is. And, what's interesting too is that stress gets a bad rap. But it's very clear in the research that human performance is at its highest point at moderate levels of stress. And so we don't want to think if we're experiencing some stress that means we're doing it wrong. It just means that our body is alerting us to something important in our lives. And so if we don't get stressed at all, we probably won't put very much effort into it. It doesn't really matter to us very much. Now, if we exceed that moderate level and it starts to then at that point dramatically interfere with our thought process, with our performance capabilities, with all kinds of different things. And this is why the first quarters of Super Bowls the stats are below the team's average during the year, because they're too up for it. Unless you're Tom Brady and you've done it enough times, I guess it doesn't matter so much. But I also want to talk about what's normal, because I'm a firm believer that so much of our suffering, this is an important thing, so much of our collective suffering happens in that space between what is and what we think should be. And if we are experiencing an emotion, like say anxiety, and we think we shouldn't be, that's going to dramatically increase our experience of distress and suffering. And so like for the younger kids, I'll have them do an exercise often in my office, my virtual office now, is I'll have them write a little short story about a misshapen cloud. This cloud pops in the sky and looks over and it realizes it's a different shape than all the other clouds around it. And it thinks it's misshapen and is so upset because it's not shaped in the same way any of the other clouds are shaped. And even the young kids will get pretty quickly that there's no such thing as a misshapen cloud, because there's no right way for a cloud to be shaped. And the cloud will constantly be changing shape. That's what clouds do. So once they get that, then I'll say, all right, now I want you to write that same short story, but I want you to do it about a misshapen feeling. And the kids will connect the dots, because just like there's no right way for a cloud to be shaped, there's no right way for an emotion or a feeling to exist. So we want to acknowledge the presence of the feeling. We want to adopt what we call a non-judgmental stance. And we want to know that we are strong enough to sit with the emotion we're experiencing. We do not need to eject that experience from our life by trying to distract ourselves or do something else. And that has its place, and we'll talk about that in a little bit. But I mentioned avoidance is the foundation of kind of disordered anxiety. And it's not, even the school refusers, it's not school they're avoiding. That's the illusion. What they're avoiding are the emotions they feel in that environment. And so when people feel an emotion, they try to avoid that. They're turning away from their own experience. And I think we all know intuitively that can't be healthy. So it's not just a question of what's normal or abnormal. It's a question of non-judgment of our experience and the knowledge that we can sit with this experience. I'll give you a little primer. One of the core things, and this might be a good one to write down, that when we're working with a kid with anxiety, we encourage them to deal with that anxiety experience, or even that frustration, or pick your emotion, to deal with that emotion in the same way that a palm tree deals with the wind. The palm tree doesn't fight against the wind because it has no need to. It knows its flexibility is the source of its strength, and it can simply outlast the wind and then come upright again. And that's one of the core skills that we really want to give as a gift to these kids, is palm tree coping. That we don't need to avoid the experience of emotion, regardless of what emotion we're discussing. Okay. Were there any questions that happened to pop up in there?
Hi, Dr. Dalton. Let's see. We do have a couple other quickies. What do you recommend for treatment options for children who are hard to understand verbally?
That's a great one. So it can be hard to be understood, and there are also our nonverbal students, which absolutely plays a role in this. There are a lot of individualized approaches to this. So I'll give you an example. So one of the first people that I treated, I was a trainee at Kennedy Krieger too many years ago to count, and it was a young woman who was nonverbal. She was on the spectrum, and she was an adult, and she was a large person, and they were she was going to a day center. It was a great program. She had friends there, great staff, but she developed a phobia of the bus to get there, and her parents were elderly and couldn't drive her. And so we had to do exposure therapy for her, but she couldn't talk. And so we did what's called behavioral relaxation training. So we displayed a body orientation that is consistent with relaxation, and then she mimicked us, and then we rewarded her when she was getting the appropriate posture. And then we just stayed on the bus. We made it fun, and man, that worked. And it was not that long after that. I was working with an adult who has Fragile X syndrome a couple of years ago before the pandemic, and he hadn't left his house in literally 5 years. I mean, he hadn't broken the plane of the doorway in 5 years, and he was verbal, but there were some challenges there. So we played games. We played Connect Four, and I sat outside and he sat inside, and then gradually I moved the board a little bit further outside, so he had to reach outside of the actual door and put the chip in. And then we played the hokey pokey, and he stuck his arm out. I literally played hokey pokey on my phone, and we did it together. I'm glad no one was filming this. And I put my arm out, and he put his arm out, and we put our legs out, and we put our butt out. And so the short answer is we get really creative for that. Okay, I can read these now. So
okay, and we have actually one more that kind of feeds into this that I'll just go ahead and share, that came a little bit earlier, but it does relate to the one that's currently on the screen.
Okay.
It was pointed out again, as you had said, there's still little that's changed in school to adapt to the increased needs of anxious students right now. So for students with high anxiety who require exposure therapy, schools aren't equipped to serve these students. So what do you recommend? And then tagging in with the one in the chat there, you have kids who never feel like they fit in at school even prior to the pandemic. So of course they're anxious and refusing school. The question is sort of, why would you force them into that environment day after day?
Great question. All right, so I'm going to divide that into two different answers. So the high anxiety one first. So I'll tell you what I've been doing with Fairfax and Loudoun and Fauquier and PG and Montgomery and a lot of the counties in the area is that I'm providing training for them. And so Fairfax, I've done a 16-hour course for people on school refusal who are there, and they have subject matter experts now who attended the course who are then called in to help with those students. Now that I just drop in the bucket, and I get it, because these counselors have hundreds on their list of students to try and help, and many of these kids have very significant needs that draw a lot of resources to them. But there are evidence-based interventions like the Coping Cat program, or for the older kids, the CAT program. It's an evidence-based program out of the University of Pennsylvania, where it can be delivered in a school group environment. For Loudoun County, I'm developing actually a curriculum for both the educational piece about how do we get the kids the skills in a curriculum, and interventions they can be doing in the school building to help those kids. So what we do is that we give this training to the school personnel, many of whom are not trained in exposure therapy. So that's the short answer to that question. When it comes to kids on the spectrum, I'm talking about this as a psychologist and as a parent of someone on the spectrum. So I come from this from two different places. It is really important that we understand that the world was designed for and by neurotypical people. And so when we are trying to say, okay, well, why isn't this kid acting the way that we want them to in this environment? With anxiety, we lower accommodation. I mean, that's our goal. The research shows that anxiety will fill whatever space you give it. And if you give people the ability to avoid the anxiety, will grow and grow and grow and grow and grow. If someone's on the spectrum, the anxiety is often not anxiety. It's being overwhelmed with whether it's stimuli that are sensory-based or whether it's cognitive overload. It can be agitation, but it can look like anxiety. So when we have someone with ASD, we move much more towards appropriate accommodations in the school environment, which I know, believe me, is a hard thing for schools to pull off, especially when there's kids who fall in between the kids who really need higher level services, like kind of the Ivy Mount levels of kids, the kids who are nonverbal, or the kids who have more high functioning ASD. And I hate that term high functioning because we know it's more of a color wheel than it is a linear depiction of how kids are doing this. But for those kids, yeah, we're not going to push them into an environment where they are getting bullied or they're not being taught the right way. In those situations, we work really, really hard to educate the school about that. For example, many of the kids in the spectrum, I'm working with one right now, the initiation of work outside of high scaffolding is nearly impossible. And so we help the school to understand how these kids' brain works and how the scaffolding can be, whether it's chunking or whatever IEP goals we're looking for. Checking for understanding is a big one for a lot of these kids, so that we can really understand what they're processing and knowing how to scaffold them in a way where they can initiate, because the cognitive overload of multiple ways about doing the same assignment will shut down many, many of these kids. Okay. Okay. Tell you what, let me go on for a little bit more and then I'll answer some more questions, because I know you have so much that I want to talk about and we have like 33 minutes left. If people can hold on. I could talk all night on these things. So I have to hold myself back a little bit. All right. Resilience. Let's talk about resilience for a minute. So here are the 10, and let's spend a few minutes going through these. So number one is connections. And the more I do this work, I come back to connectivity as the most important keystone aspect of how do we help kids be resilient. And we've known for years and years and years that the experience of being supported socially is a protective factor. Think of it like vitamin C against depression and anxiety. Now, in the last year and a half, we've never had a higher need nor more obstacles to obtaining that level of connection. And so I think, and I don't know if the data is out there yet, but I believe that this is one of the main reasons why we're seeing an explosion in this level of suffering in the teenage years, because these are the years when peer connections become so central and they were so hard to come by for so long. It's stripping away the immune system for mental health challenges. So the more that we can, as parents, facilitate, or as educators, facilitate connection. So for the educators on the call, if there are some kids on the periphery, kind of 1 foot in the door, 1 foot out of the door, they haven't really found their tribe yet, have a pizza party where the kids get invited, but no one knows why they're being invited. And you can just tell them, oh, draw names out of a hat, and this month your name came out. But really, you've chosen people that you think, if they have a shared opportunity to get to know each other, they have a lot in common and they could form connections, but they lack that space, that contact. So let's facilitate those connections among those kids. That's part of the reason why I love doing group therapy with teens, because man, these kids, they are starving for connectivity. Number 2 is altruism. And the data is very clear about this, that if we can do something for other people, that doesn't just help the other people, it helps us too. And so having students be doing something that's in line with their values, especially something related to what's causing them stress. So writing thank you cards to first responders or ER staff or whoever it might be, that's going to give them some experience of agency over what's going on. Structured routines. So I think of the 3 C's: connectedness, continuity is the second C, and then creativity will be the third C. But structured routine, it strips away a lot of need for our brain to focus on different things. So it puts some things on autopilot, and it leaves more bandwidth to cope with other things. That's basically why routines work. But think of those as like the little kids when you go bowling and you have the bumpers you pull up so that the ball can bounce around but still go straight. That's what we look for with a routine, is that it's containing. It gives the kid boundaries. In addition to that, being able to take breaks and knowing how to take a break, because a lot of kids don't know this. And so they confuse breaks with avoidance. And so they'll think, oh, I'm having a negative emotion, so therefore I'm going to take a break right now. Rather than being able to tell themselves, I can be anxious or I can be frustrated, and is everything, so that's such an important concept when working with anxiety or other kinds of challenges. I can be anxious and is life. And so we want to schedule breaks based on a pre-planned idea. Well, let's work for 5 more minutes or 10 more minutes, age appropriate level, through the frustration or through the anxiety, and then let's take a break so we can practice turning those blisters into calluses. As an aside, made me think about this. A couple of years ago, like about 2 years ago, actually, I was working down in Fairfax because I have an office in McLean, and there was a girl. She'd missed 2+ years of high school. Not uncommon for the kids I work with, but she did. And I think she also had ASD, but wasn't diagnosed. And so I asked her, I said, I want you to fill in the blank in this sentence. I can be anxious and blank at the same time. What's your blank? She thought about it for a minute. She was a quiet kid, but she got this steely resolve look in her eyes. I thought something was wrong, actually. And I said, what are you thinking? And then she got this broad smile, and she said, I can be anxious and strong at the same time. And you know what? She was right. She got into school 2 weeks later and graduated on time last year. I got a picture of her. She wasn't even seeing me anymore. I got a picture of her in her graduation outfit. Remarkable. I asked a younger kid that same question. He said, I can be anxious and brave at the same time. And if there's one thing I could teach kids, this would be it, is that you get to be anxious and brave at the same time. Courage is what you do. It's never what you feel. I asked an older kid who was like 18 and been doing this for a while. And I said, all right, finish the sentence. And he said, got the smile on his face too. And he said, I can be anxious and any damn thing I want to be at the same time. And so that is treatment. That is that knowledge base that we want to have. And so taking breaks, not because of the emotions you're experiencing, but because you've planned to take a break, is a great way to foster resilience. But the second to last one on the left column is one of the most powerful things that you as parents can do. And that is cope out loud. I want you to model self-care. I taught the same thing to teachers. Talk about what you are doing to pursue balance in your life. What are you doing to rejuvenate yourself, to seek out time, to rebuild what's being depleted? So many parents get into the mindset that kids come first, and I get it. I got 3 of my own, and that, I'm going to just kind of give and give and give like the giving tree. And then what do the kids learn? Well, they learn that we aren't that important enough to take good care of ourselves. Whereas if you are coping out loud and modeling self-care, the kids will learn by observation to do that too, now and when they're older, which is a wonderful gift that we can give them. The last one here, the acceptance of change. Acceptance is not equivalent to endorsement or approval. It just means that we are not arguing with reality. It just means that this is the current state of affairs. Darwin knew this, right? He said that evolution, well, actually he didn't quite say this, it was attributed to him, but it summarizes him nicely, that evolution doesn't favor the strongest or even the most intelligent. It favors the most adaptable. And so we know that adaptability is nature's highest virtue, literally. And so what's the first step of adaptation? Acknowledgement of change. So we have to work on that. When going up to the next column now, when I do my groups for kids, we end every single group with the kids naming their own goals for the following week. And the goals should, and it's actually from individual sessions too, that the goals should be measurable and achievable before we meet again. So last week I had a kid say, I want to take better care of myself. I said, great, how would we know it if you were doing that? And they said, okay, I'm going to call 3 friends I haven't spoken to in a while. Okay, great, that's measurable. That helps us move in the direction of our values and our goals and know that we are moving closer to those goals. And I care much more about the direction of travel than the speed of transit, honestly, for these kids. But having those goals is really important. The next one, I mentioned the IEP and the 504 kids as a shorthand for the kids that you guys love and that I love, and that they have had a hard time keeping a positive self-view, many of them at least that I'm working with, because they're watching themselves struggle and fall behind and not be effective in many areas of their lives. And that scares me. That really scares me because, first of all, it's not true. And the next slide, I'll mention how I'm approaching this with these kids. The next one is about kind of the same thing with modeling self-care. It's modeling an optimistic outlook. We know that optimism is a great reservoir of resilience. And that just means that people who experience high levels of anxiety, they experience uncertainty in the way that other people respond to threat cues. In other words, anxious people see uncertainty itself as threatening, which means they're looking at it through a biased lens. Because uncertainty just means we don't know. It doesn't mean bad, doesn't mean good, it means we don't know. So optimism is a way to challenge. If we have an immediate pessimistic thought, we've all had the experience when we were younger, right? There's some kid in first grade who's going, ooh, I know the answer, I know the answer. Does that kid have the right answer always just because he raises his hand first? No, in fact, he often doesn't because he hasn't even processed the question. And when we have a pessimistic or an anxiety-based thought, it's just our first thought, and being first in line does not make it more accurate. So being able to think of other ways to think about that same situation creates optimism, because we can also imagine positive outcomes for situations like that. I want to spend a few minutes talking about the last one here, which is self-discovery. So I'll say this twice because I believe in it so much. I think that human suffering and struggle are pregnant with meaning and purpose. Again, human suffering and struggle are pregnant with meaning and purpose. If you look back to Viktor Frankl's seminal work in Man's Search for Meaning, those of you who don't know, he was a psychiatrist who survived the concentration camps, the worst that humanity has to offer. And he found the obvious to be true, which is that if our goal is to try and avoid suffering, we are doomed to fail from the onset, because suffering is so intertwined with our existence that we can't have one without the other. So if we can't avoid suffering, what do? Well, we can find meaning within it, and that changes the whole narrative. And so I mentioned before how the kids, even 2 years ago, were 5 to 8 times more likely to be anxious than the same kids during World War II and the Great Depression. Well, I'm wondering if there's a reason for that besides social media and the other things going on in the world right now. I think it's because those kids learned about themselves, that they can do hard things. And so as we're talking to these kids, whether we're doing it as educators or parents, framing questions such as, what have you learned about yourself during the last 615 days, I did the math out, that you didn't know before? What has surprised you about what you've been able to do? I don't know the answers to those questions, but I know they're the right questions because they're going to orient them to growth. Because we know that comfort and growth are almost always incompatible experiences. And so if we can help the kids to really consolidate their knowledge, to think through this and learn about how they've grown, what they've discovered about themselves they wouldn't have learned any other way, about flexibility and creativity and all of those things, now we are arming them with self-knowledge they can carry forward. Okay, really important thing. I mentioned that the kids who are maybe not having such a positive view, and so this next slide I think is really important for SEPTA because it's, I think, so much experience. So, all right, there's this idiot on the left who drove his Ferrari on the beach. I think he should be barred from ever owning Ferraris again. Not that I've ever been in a Ferrari. And it's stuck. It's not going anywhere, right? But that Ferrari still has the same engine. It has the same handling and suspension, the same beauty, the same sound system, same paint job. It's just being asked to do something it was never designed to do. Now you take that Ferrari off the beach and you put it on the track, and it's going to go, go, go. And what kids are lacking when they have these acronyms that explain their learning differences or their neuroatypicality, what they are forgetting, because how would they know, is to contextualize this, to understand that the challenges they're seeing aren't because they've lost intelligence or ability. It's that they are being asked to do something they weren't designed to do. I mean, what's faster, the Jeep or the Lamborghini? Well, it depends entirely on what surface they're driving on. You can't answer that question, because if you're off-road, it's one answer, and if you're on a track, it's the other answer. And so helping kids to understand that just because they're a Jeep does not mean that they are flawed. It just means that they haven't been being played to their strengths. And I want them to understand the environmental impact of their struggle, so that they are seeing this less as characterological and more as situational, because the research shows that is really important for all of our well-being and all of our understanding of ourselves. I mentioned that one. I'll skip over that one because we have not a huge amount of time. But tolerance for uncertainty. I mentioned before, rather than trying to convince ourselves that we're certain, rather than trying to argue with ourselves why the bad thing is unlikely to happen, we don't want to invite the heckler onto the stage and have a debate with them. We want to just say, basically, I don't know, that makes me anxious, and that's okay. See, when you're pursuing your values and you're experiencing anxiety while doing so, I want you to think of that like you're getting sweaty at the gym. It doesn't mean you're doing anything wrong. It just means you're getting a good workout. And so when we're facing uncertainty and we're experiencing anxiety, okay, there is nothing wrong with that at all. It doesn't mean that we have to suddenly change what we're doing because we're feeling distress. We can persist in the presence of anxiety, which is so important to understand. Now, I mentioned self-efficacy, and this is that one I want to spend a few minutes talking about. So the dictionary definition, you can read it there, is that an individual's belief in their capacity to execute behaviors necessary to produce specific performance attainments. All right. It just means how effective you believe you can be in performing what you feel like you need to do. And the research shows time and time again that this measure is predictive of treatment outcome, of resiliency, of all kinds of things. And it's teachable and it's learnable. And so this is where we want to put a lot of our focus to help these kids through this challenging time. That lifeboat example, this is the paddle that we want to use to steer that lifeboat around. Number one, are mastery experiences. Doesn't mean you're the best in the world at doing something. It just means there's an area of competency that you feel good about. So my 11-year-old daughter, dance. She did not get it from me, I promise you that, but she's really good at it, and it got her through the pandemic beautifully because she had her people and she had her thing, and she's really good at it, and that was an area of known competence. For some people, this is video game playing, which I know is a dicey topic, but many of these kids it's an area they're good at. And so we don't want to think of it just as this pathological use of technology, which it certainly can be, but it's also a source of ego strength for people. I had a kid years ago who was a world-class yo-yoer. I didn't even know that was a thing until I met this kid. But he was nationally ranked, and he could do things with a yo-yo I had never even thought possible. That was his mastery experience. The more that we can give kids opportunities for mastery experiences, the more resilient they will be. Number two, vicarious experiences. Another reason to cope out loud. And even the Ivy League is doing this, where they are having the professors talk about their struggles getting to where they are, not just the diplomas on the wall behind them. And so hearing about things that you have overcome. I gave a talk to my alma mater high school a couple of weeks ago, Good Counsel High School. And I began by talking about the first test I took as a freshman in that school. It's a true story. My geometry test, I got a 12% on. And so they introduced me to this long biography of all these things that I've done. And so I began with, and I got a 12% on my first test here. So the more people can hear about vicarious experiences by people they care about, or even by reading books has been shown to help this. There is a wonderful scene in a movie. The movie is called Facing Giants. It's on YouTube. You can find the scene. It's going to be an awful sounding scene, but it's called the death crawl scene. No one dies. It's just an exercise in a football practice of someone who does something beyond where he thought his limits were. It's a powerful scene, and I show it to a lot of my patients when they are struggling about maybe believing that you can do more than you think you can do. Verbal persuasion. It is so, so important for kids to hear from the adults in their lives that they believe in them. That you know it can be hard and you know they can do it. These are things that can really, really improve self-efficacy. But let me tell you the story about how I teach this in my sessions or when I give my trainings. So there's this bird on a branch. And let's say the bird looks over and it sees there's a crack next to the trunk of the tree. Is the bird unafraid because it can think of all the reasons why the branch is strong and unlikely to break? Or is the bird unafraid because it knows it can fly? Knowing you can fly is self-efficacy. Knowing you're going to be okay, not because the bad or hard thing isn't going to happen, but because you know you'll be okay because you can handle bad and hard things. That is the central message that we want these kids to learn. And hopefully, this is maybe one of the few silver linings of the pandemic, are that kids are learning that they can handle bad and hard things. They're not fun, they're struggling. Some have suffered immeasurably during this time period. But that knowledge that you can be okay, not because the bad things aren't going to happen, but because you can handle bad things, is so central to this process. So tell you what, I'm looking at the clock, and I could go on, like I said, forever. We have 12 minutes left. I'm going to stop here and open it up for questions from the audience, those of you who've been brave enough to stick around until almost 9 o'clock on a Tuesday evening in November.
Do you want us to go through some more of the questions that we've been collecting in the chat, or you want to just open up?
Any of those are fine. But there are some that are themes. Feel free to read me some things from the themes, or I could open it up for new questions too.
I've got a couple that are relatively quick. One is, do you have any picture books that you recommend for younger kids to communicate and teach that palm tree coping idea?
That's a great question. I kind of came up with that one on my own, so I don't know if it's in a book. Maybe it's in a book somewhere. Up and Down the Worry Hill is a good book for younger kids to read. It doesn't actually have that same palm tree thinking in it, but it's a good solid book for people to read.
Great, thank you. Interesting question. Looking at people who, children who experienced trauma. Later on, then, how do you discern between behavior and symptoms that are trauma responses versus things that could be considered anxiety disorder?
Well, so trauma can be part of an anxiety response. So PTSD is part of the anxiety disorder. So it's a little bit hard to differentiate between those two. But trauma manifests, it can look very much like inattention. I see plenty of kids who dissociate when they're experiencing or re-experiencing a traumatic event. So they're just vacant. They're there, but they're not there. But a lot of kids exhibit trauma reactions in, we call them externalizing behavior problems, where they're doing things that are disruptive. And that's why trauma-informed education is so important, because the kids are displaying the reality that they're suffering and struggling. And I'm a firm believer that every kid is as successful as they know how to be with the skills and tools they currently have. And so it's always because of something. And so if we are seeing themes, if we see kids that are suddenly having really sharp declines in their functioning, homework completion rates, absenteeism, somatic complaints, then we want to obviously take a close look at that and see if something traumatic is happening in that way. But there also can be clearly a delayed reaction to traumatic events that sometimes can come up a long time. And part of what we see is that sometimes kids get frozen in time when they've been through a trauma. I had a kid who lost his dad before 6th grade, like the week before 6th grade, and he stopped developing. I mean, he just literally stopped developing at that age. And after a while, it became clear that growing up meant leaving his dad behind, and that was too scary for him. So he was going to stay that same age as long as he possibly could.
Wow, you got me on that one. Another question going back to the books recommendations. Do you have recommendations for books for teens or a little bit older kids?
One of my colleagues, Bonnie Zucker, who's fantastic, she's a local psychologist. She has a book called Anxiety-Free Kids. That one's a great one. There is some research out of Yale, a colleague of mine, a great guy, Ellie Leibowitz, has developed what's called SPACE program. It's an acronym, and it's basically an evidence-based program to help parents of anxious kids and teens to reduce their accommodation of anxiety symptoms in the home environment. And the data out of that is wonderful because it's showing that that is as effective as individual treatment in reducing the experience of anxiety among kids. You know, in our practice, we do both. We do parent training. It's very counterintuitive, and the more compassionate the parent is, the more vulnerable they are for getting it wrong, by the way, and individual exposure-based for the kids. Those two are effective. So breaking free from anxiety and OCD, I think, is Ellie's title. I always forget the generic name, but look up Ellie Leibowitz on Amazon and you'll find it right away. It's a really powerful book.
Thank you. Couple other ones. There was a question about looking at exposure therapy and whether that is a form or similar to ABA or behavior modification. So if you could just briefly elaborate on exposure therapy and how it differs.
So yes, I'm very familiar with ABA. I did that at Kennedy Krieger for a long time. Behavior therapy is one technique under the umbrella of behavior therapy. So it's all about behavior change. So ABA manipulates the environment and contingencies in order to change behaviors. You look at the function of the behavior and you look at it, how to cut that off that pipeline of reinforcement. You see the extinction process play out. Exposure therapy is simply a way to convince someone to go against 1,000,000 years of evolution and to lean forward into their anxiety rather than to lean away from it. And so they're different but related. And that's why I named my practice Center for Anxiety and Behavioral Change, because applied behavior analysis and exposure therapy, they borrow from the same rule book, basically.
Somebody put in the chat asking, is the book by Ellie Leibowitz, Treating Childhood and Adolescent Anxiety, a Guide for Caregivers?
That is the more academically oriented one. And there's a new one that was published about a year-ish or so ago that's more for parents.
Okay, and I have also heard Bonnie Zucker's books being recommended many times as well. So I'll just throw out another plug for Anxiety-Free Kids.
Yeah, she's a good friend of mine. She's fantastic.
Terrific. Let's see. One other question. What are some examples of how anxiety manifests outside of kids verbalizing their feelings?
Somatically, with the body. So the younger the kids, the less words they have to describe it. And so kids will often talk about their stomach hurting. They may even vomit. Headaches, fatigue, dizziness. Those are all classic things. But the purest measure of anxiety is avoidance. And so if you see someone, a kid who is saying, no, I don't want to do that thing, that's out of character for them, just refusal. That's a clear way to understand it for a lot of people.
All right. I think that we worked through all the questions that had come up in the chat. And speaking of practicing resilience, my computer froze on being able to access my Zoom. And so I had to take over my husband's login on Zoom. So I don't have controls to be able to unmute people or call on people. So we just have a couple minutes left. If anybody has other questions, why don't we put them in the chat? Oh, what if there isn't avoidance? I have a child with diagnosed anxiety, but I don't see avoidance.
I promise you it's there. Yeah, it's probably avoidance wearing a disguise. So people who are worrying a lot, for instance, when you are worrying, the function of worry is to lower physiological arousal. So you're avoiding the experience of anxious arousal by making it more linguistic. So even worrying itself can be conceived of as avoidance because you're avoiding the activation bodily of that experience. So I think that I've never met a kid with anxiety that doesn't have some level of avoidance of the emotions they're experiencing in that way. So it's a question of kind of putting on your detective hat and seeing that. And yes, it's breaking free of child anxiety and OCD. That's the Ellie Leibovitz book I was talking about before.
Wonderful, thank you. I'm not seeing a whole lot of other questions popping up. We do actually, Amanda's giving me a reminder here. For people who are on tonight, who are members, we actually have some books that we're going to raffle off that have to do with special education. And I think we are going to do that afterwards. I'm looking at the screen and realizing Amanda can't see me. Amanda, can you unmute and just touch on that? In the meantime, is there a specific book you recommend for parents that have children with Down syndrome and anxiety?
Oh, that's a great one. God, I love Down's kids so much. I don't know of one on top of my head. I think that the same basic principles, though, are very effective. So I would say Ellie's book, again, would be a solid one to use for that.
Thank you. All right, let me see. Hold on. Speaking of resilience, again, we're bearing with us. Yes, Amanda, the books. I wish that we had a stack of books on anxiety that we could be raffling off tonight, but we don't, unfortunately. We do have some books. I believe that they are.
The 3 books that we have are the 3 Pete Wright books. From Emotions to Advocacy, all about IEPs, and then his special education law book.
Fantastic. So after this is over, we will be pulling names at random from our attendees who were here, who were members, and we will reach out and be in touch with you all about that. Any last words for us?
For me?
Yeah.
Oh, so again, just the idea about being anxious and that we want to divorce anxiety from the urge to avoid the experience of anxiety. Last little nugget I'll leave you with is kind of a way of thinking about things. I wish I could talk for hours more about this, but I want you to think of your child as being separate from their anxiety for a minute. And I want you to think of their anxiety as a dog begging for food, only it's not begging for food, it's begging for attention and escape avoidance. And so I know when one of my dogs is begging for food, it might be tempting to say, okay, fine, here's a big piece of my steak, now go away and never beg again. But we know what will happen, right? And so the best thing to do is to not feed a dog and hoping it stops begging for food. So when we attend to give reassurance to an anxious kid, when we facilitate avoidance or escape because of discomfort, we are feeding the dog and hoping it stops begging for food. Okay. And so that's really counterintuitive. So we want to catch the kids coping effectively. The mnemonic for this is that we want to water the seeds, the things we want to see grow, and not the weeds that we want to see wither. And if we can consistently over time water the seeds and not the weeds, the seeds will grow and the weeds will wither. That's the most powerful tool parents have here, is trying to water the seeds and try our very, very best to not water the weeds when they happen. Okay. Other than that, thank you again for all of the work you guys are doing during a tumultuous time. And I really value the time and invitation to come talk to you guys.
Well, we very much appreciate you giving your time to join us this evening. So it's been a long evening with us, and thank you so very much for spending time with us this evening. Every time I hear you speak, I feel like I've taken away more pieces and had wonderful reminders from workshops and trainings that I've gone to. So it's always just a pleasure to hear you. Thank you so much.
Thank you so much.
And again, to everybody, if you're not a member of SEPTA, please go to our website and join us. If you have any extra funds that you're willing to donate to us, please feel free to go to our fundraiser and donate as well. And again, thank you all so much for coming out tonight and for your patience as we plugged through our fun and excitement with our technology.
Michelle, can you put the link to join SEPTA and the fundraiser in the chat real quick so people can click it?
You would think that I maybe could. Here, hold on. If you go to fairfaxcountysepta.org, that will at least take you to our website, and that can take you from there to
Membership and
the PT board. There we go, Amanda, to the
Perfect.
rescue. Thank you. I had to literally shut down every single window on my computers because my Zoom totally froze. My husband came in with his work computer for me. So thank you all again for joining us this evening. I can't even like click buttons to send people away. So have a wonderful night. Thank you to all of our guests. Thank you to our board members who are here. And many of you offered to sign up for committees. We will reach out and find you.
Thanks again, guys. All right, bye-bye.